And then she also was letting me know that it was some violence going on right in front of her, how could we get a hold on that?
This is the daily briefing of the Safe Streets team at its Belvedere site in Northwest Baltimore. A time to check in on themselves and the neighborhood.
We get a reading on the temperature of the community, find out if there's anything going on in the community, such as a beef, if any individuals return from jail that may be shot callers or key individuals, if there's anything that's going on in the community, period, that could probably escalate to a shooting or homicide.
One of 10 Safe Street sites in Baltimore. This one is operated by LifeBridge Health, one of the city's hospital systems. It is making an unprecedented investment in community violence intervention, starting with a steady stream of gunshot victims that arrive in the ER.
The trauma department in the ER calls us. If there are 3 or more shootings, they text the team, because when that happens, the potential for escalation. So you have 3 people who come in with gunshot victims. So that could escalate on the street 10 times over.
I was a victim. I got shot right here. This is a little plate.
Lamont, a hospital responder, is now using his own experience to calm gunshot patients who may only want to strike back.
If I know if I'm going to retaliate every single time, my mindset's so focused on retaliating every single time, not only am I going to not feel right, I still have a family. I can't have my family thinking that all I'm thinking about and worrying about is retaliating.
Baltimore historically has relied almost exclusively on policing to try to reduce violence. That the city remains one of the most violent in the country underlies the argument the administration of Mayor Brandon Scott is now making to invest in and expand community violence intervention.
It really is exactly what it sounds like. It is using our community-based assets, institutional, people, medical systems, those folks that have intimate awareness and connectivity to folks who are at most acute risk, actually doing the work of intervention.
The mayor recently directed $10 million in federal rescue funding to expand community-based services and get more hospitals on board with hospital-based response. The goal is to connect hospital systems, community organizations, and Safe Streets in an integrated network. What's been lacking in the past, city officials say, a coordinated network of resources outside of the criminal justice system.
I honestly think that the biggest shortcoming of Safe Streets was not the program itself. It was the lack of support provided by previous administrations. All of the community-based organizations pretty much were on their own to figure out what fiscal management looked like. They were on their own to figure out what engagement with community members looked like.
The challenges are steep. The communities most plagued historically by gun violence have been weakened by a sharp population loss. Now, fewer people to get involved at the community level. According to an I-Team analysis of census data, between 1990 and 2020, the population has dropped by 51% in the areas in West and Northwest Baltimore with the highest concentrations of violence. Last week, some city council members demanded a short-term crime plan. The public rarely has had the patience for longer-term solutions.
Oh, I think the appetite's there for community violence intervention. I think people haven't necessarily known what the roadmap is, or that we've had programs that have started in fits and spurts and then didn't have the sustainability.
Adam Rosenberg heads the new Center for Hope in the LifeBridge system, a first-of-its-kind effort at putting services for victims of street violence, domestic violence, and child abuse under one roof.
I think people don't want to live in violence, and I don't think people want to be victims of violence. And so I think people are eager for it, and probably with that eagerness is a dose of skepticism that a lot of people, maybe myself included, have said, like, I've been to the movie before, I know how it ends. And I think it's up to a lot of us, not just us here at Center for Hope, but to prove that this is going to work, and to demonstrate what works, and when it doesn't work, rather than give up, all right, how do we fix it?
Something new, the legislature this year passed a bill to have community violence intervention services covered by Medicaid that could make this effort more sustainable, as it makes it less dependent on who's in City Hall. For the 11 News I-Team, I'm Jane Miller.